Hi, my name is Mary Louise Van Natta, and I'm bringing you today on CCTV a great program. We're going to be talking to the folks from Diabetes Support Services. That's an extremely important issue in our community, and I want to make sure that everybody knew what's going on with this important issue. So today I want to introduce two great guests, and sitting to my left we've got Nathaniel and Sandra. You guys want to introduce yourselves for the audience?
Thanks so much, Mary Louise. My name is Nathaniel Darnell. I'm Vice President of Diabetes Support Services.
And I'm Sandra Underberg, and I am President and co-founder of Diabetes Support Services.
That's great. Thank you so much for taking the time for me today. I really appreciate it, and to talk about this important issue. Now, I have to say, before I met you two, I didn't know that much about diabetes. We know a lot of people have had it, a lot of people are worried about having it, and I know that there's more than one type, and I'm not totally clear on all the differences, so I was wondering if you could describe that for me, and for everyone here, so we can...
Certainly. Unfortunately, too many people are finding out about diabetes. It's becoming an epidemic. And basically, there are three types of diabetes. There's type 1, type 2, and gestational.
Oh, okay.
Right. Type 1 is the one that my husband has. He's had type 1 diabetes for 53 years. And that is basically when the pancreas throws in the towel and quits working, and insulin has to be injected into the body to keep everything stable. Type 2 is when the pancreas slows down and the insulin can't get into the cells. And it used to be called the old people's disease years ago.
But I hear that's not true anymore.
Unfortunately not. There are children who are getting type 2 diabetes due to lack of exercise and improper diet. And then, of course, gestational diabetes, when a mommy gets diabetes during her pregnancy, and often goes away after the baby is born, but they are still at risk in later life.
Okay, so type 1 is something that you're born with?
No. Not born with, no. The pancreas can quit at any time.
Okay.
My husband was 21 years old when his stopped working.
Okay, so that really could happen to anybody regardless of their lifestyle choices.
Absolutely.
It's more of a medical condition.
Absolutely.
And type 2 is the one we worry about if we haven't been taking care of our health.
Yes.
Often.
Yes,
Okay.
and it can happen from that, absolutely.
Okay.
Right.
So really all of us, except for men and gestational diabetes, this issue is important to all of us.
Yeah.
It is
because
very
any of
important.
us can have that and have to face that, and probably have to make some surprising lifestyle changes.
Well, in family.
Oh, and sure.
Just imagine, both your children and your parents are not at much greater risk of developing diabetes.
So I understand that, Sandra, you really have a story that propelled you into this, into working in this foundation, in this organization. Can you tell me a little bit about that?
Certainly. It all started, the reason we started Diabetes Support Services was that in 2007, in April of 2007, a friend of mine was diagnosed with type 2 diabetes, and she was very ill. Her husband was unable to drive, and so she called and asked if I would drive her to the classes at Salem Health. And I said I would be happy to do that. I had to get her there at 8 in the morning and pick her up at noon. And then I thought about it, and my husband at that time had been diabetic for probably 44 years, and we had never gone through any classes, any education classes. And so I called her back and said, why don't you see if I can go as your caregiver? And so at the end of those 4 days, somebody raised their hand and said, is there some kind of ongoing support that we can learn more? Because you're pretty much inundated with an awful lot of information, and the people who were newly diagnosed weren't feeling well, and they just couldn't absorb the information. And so, like I said, be careful what you pray for, because I was looking for a cause, and I just felt like we were called to do something and start some kind of a support group for these people who needed the information.
Now, I imagine you referenced your husband when you found out that he had diabetes. You didn't. Nobody plans to get into that situation. That must have been quite a shock for you at the time.
It definitely was. It was back in 1962.
Oh my. Okay.
Right, and so it was a horrible shock. I was pregnant with our son, and so he was diagnosed as a type 1 diabetic. We didn't know anything about it. Things were done very differently back then. So after our son was born, I was sterilizing baby bottles on one burner and his insulin syringes on another. And so at that time, the doctor gave him a life expectancy of about 45. And a few weeks ago, he just celebrated his 74th birthday, so
Wow.
there is hope.
So you had to go through, though, it sounds like some life-altering changes. You're just going along, eating what you want to eat, doing your life, and then everything had to change.
And it isn't only the patient's disease, it's the family's disease. Everyone in the family needs to know what to do if a low blood sugar occurs. They need to be aware of situations that go along, complications that might occur. And so it's a whole family disease, and everybody has to work together to be successful.
So you found that you just couldn't, you get a diagnosis, you go to the doctor, we say, we're sorry you have diabetes, good luck. And so that really spurred you on, it sounds like, to really get this organization kicked off. And then as the times progressed, finding that we have more resources to reach out to people, and I think that's where Nathaniel comes in more with your technical background. Is that true?
Well, partly, yes. I have to admit, though, that it's certainly, we've all worked very hard, but the whole organization has just been incredibly blessed. I mean, we have one God wink after another. Sandra and I crossed paths after I had semi-retired from the technology industry just for my own health. And I was actually volunteering at the homeless shelter, and we were dealing with a lot of homeless that were suffering from diabetes, and
probably not being properly treated.
Well, it's
it's
a combination of things.
Yeah.
They don't have adequate resources. The food that's offered to them doesn't help, obviously, and so Sandra and I actually met one another at a public health event that one of my colleagues had requested that we attend, and a short time later, Sandra had already befriended Jungi Hong, who was one of the assistant professors of exercise science at Willamette University. And so a short time later, we were collaborating on projects to help improve quality of life for the diabetic population. And that's since grown to research collaboratives with OHSU and now Kaiser Permanente.
Wow, fantastic.
So things have just been kind of this progression, which I'm not sure that any one of us really kind of did it, if you will. We were just all kind of in the right place at the right time, and the universe just kind of worked to bring us together, I guess. Even our human resources director is the former human resources director of Evergreen Aviation.
Great.
And
So lots of technical business. Yeah, because it seems like diabetes is an equal opportunity.
We joke about that, but it's true.
Disease.
Yeah.
You don't hit. It doesn't stop for
No.
rich, poor,
That's correct.
kings, and
Yes, we do not discriminate. All kinds of all our clients, regardless. So.
So you brought a lot of people into this team, and then formed kind of diabetic support services.
Well, that was formed over 8 years ago, actually, but it's been this process of evolution. Starting as a very small group, and then the community really informing us that they needed what we were delivering,
Right.
and then we had to expand and grow to kind of expand. Fulfill that need, if you will.
Sure.
I mean, we went from a group of 10 people to now we're serving over 100 people per month right
And what
now
kind of
locally.
services would that include? If I came to you and said, my husband, my son, I have been diagnosed, what would you offer me, or what can I?
Well, that's the answer best provided by Sandra, because that's what she does all day long. I sit more or less in the background, but.
Well, we started out with support group meetings, and originally we named our group My Pal Sticky, and we had a porcupine as a mascot. And there is a story behind that as well, because a friend told my husband when he was diagnosed, why don't you get a porcupine, feed it insulin, sleep with it so you don't have to take all those shots. And so we thought that we needed an icon that would attract parents with children with diabetes. And so they did come to our meetings. However, when we advertised our first meeting, we had 150 people there, and most of them had gray hair. And so there were a lot of medical people who were interested, suppliers of diabetes services and supplies, that kind of thing. And then we realized that My Pal Sticky was a little bit too juvenile, and so we grew it up and named it Diabetes Support Services, and changed our program just a little bit. So we went along for a couple years, and then discovered that we really needed to do something in the afternoon, because a lot of these people can't drive at night, or they depend on public transportation. And so we started an afternoon group here, and then another afternoon group there. And so as of next month, we will have 4 groups running each month, and everything is free to the people who attend. We give away donated supplies, test strips, testers, syringes, lancets, anything that they might need. If they need one-on-one consultation, we sit down with them in our office for an hour, 2 hours, whatever it takes, hand them brochures to take home and read, loan our DVDs. Everything is filmed from our evening meetings, and they can take those home and look at them at their leisure, and then come back with questions.
That's wonderful. So maybe help me step back and understand what it's like to be a diabetic person in Salem, Oregon. What kind of problems would I face, or would these young people face every day? Because I'm not familiar. I'm seeing people with the hip, and I know that we've been working with some folks like that. Tell me what that looks like every day.
I can give first-hand information on that. I live with it. I have lived with it for 53 years.
Yeah.
It's, first of all, it's terrifying to somebody who gets a diagnosis, because there are all those rumors that you're going to go blind, you're going to lose your kidneys, you're going to have a foot amputated, and without the proper care and keeping the blood sugars in control, those things can happen. And that's why we work so hard to educate people to keep their blood sugars in control. But it's a 24/7 disease. You don't get a day off. You have to be aware constantly of what is going on in your body. And what I teach in my classes is that you're a snowflake. You have to be aware of your body, but what works for you might not work for somebody else who has diabetes. And so listen to what's going on and look at your numbers, that sort of thing. So first thing in the morning, a diabetic has to check their blood sugar. And then they eat a meal. 2 hours later, they check it again to see how the meal affected it, whether the medications are working. I mean, it's just a constant routine of having things to do to keep in control and keep healthy.
So I know technology has changed a lot for diabetics over the years, and even since, well, obviously since your husband was diagnosed in the 60s. What have you seen in the industry changing as kind of a techie guy?
Sure. Well, obviously there's the insulin delivery pumps, which that was the small box that you were talking about. And coming around the bend, we'll possibly see vaccinations for diabetes type 1, but sooner than that, what we'll see are glucose measuring devices that normally you have to prick your finger and take a blood sample. And, in Sandra's discussion, we didn't mention the cost, but something that many people aren't aware of is that can cost you anywhere from $100 to $300 a month just for these little test strips. And when your doctor wants you to test your blood all day long, that's an associated cost that it becomes very expensive just to manage the disease. So hopefully very, very soon we'll have simple things like even a thumbprint on your smartphone, where your smartphone can just shoot a laser at your thumb, and these are in development.
Wow.
Where it can instantaneously determine your blood sugar level.
How exciting.
Yeah.
Well, that's wonderful.
But something else that's more organic, Sandra's husband actually has a diabetic service dog. And what we found is that in some cases, they're actually more attuned than some of the technology.
Now, so a diabetic service dog would tell him when he's going to has low blood sugar, or?
Low and high. Yes,
Really?
Yes.
And I'm assuming that's through smell.
Yes, absolutely. And so but he senses everything. He's just aware of everything that's going on in his body at all times. And so he gets up into his nose and sniffs in his nose when his blood sugars go low, or he goes into his ear when they go high, and we don't know how he does it. He's a little chihuahua.
A chihuahua.
Seven-pound chihuahua. Yes.
A diabetic support chihuahua. I love it.
Yes,
That's
yeah.
fantastic.
He's quite the character.
That's fantastic. Well, we'll have to have another show and bring, what's his name?
His name is Cozy, short for glucose.
Oh, we'll have to have another show and bring Cozy back and show
you would definitely regret that.
We're huge animal fans here at CCTV. Well, how exciting. So that does sound like we've got some more optimistic outlooks for folks.
Always, and that's what we do at Diabetes Support Services. We provide hope. One of the challenges that so many newly diagnosed diabetics run into is they fall into the traditional Western medical model, which is great at acute care, but it's not good at long-term care. And they immediately receive, as Sandra mentioned earlier, just this deluge of information,
right.
and it's so complicated.
And the
It's-
internet
it-
just
it's-
doesn't help. Sometimes
it
it's
doesn't.
so much. So.
And it's disempowering, and then they come to us and they realize, wow, you guys are down to earth, you're real, I can understand these things, you're providing real solutions, not just more complications. And so we're developing this very large following, and just kind of organically, and now we're growing up and we're taking on more responsibility and building out our organization so we can service the rural community. Sandra and I were just out in Lincoln City yesterday
Great.
talking with their Chamber of Commerce, and they're just thrilled at what we're doing.
And so one of the tools I know you provide on your website is sort of taking that massive amount of material out there and funneling it down so people can manage it. What kind of things would we find on, if we can't get to your office, what can we find on your website that would be helpful to folks? And that's, remind me of that website address again?
It's www.sugarsmart.org.
Sugarsmart.org. Okay, great. So what will they be finding there?
Well, actually, for somebody who is just newly diagnosed, if you go to www.sugarsmart.tv, we have several videos we have filmed
Great.
and have
the video
there.
world for sure.
So somebody who doesn't know how to test their blood sugar, they can click on that one. And we have Kellyanne Garthy, who's professor at OHSU Monmouth in the nursing department, who has done a demonstration on how to do a proper glucose testing and also how to do an insulin injection. Plus we have other ones that Nate has. Nate has a number of interviews and so forth that he has posted, and so there's a lot of information right on that website.
Great.
But our .org website actually has our meeting flyer, so people who are interested in coming to a meeting and learning. Our evening meeting is always features a keynote speaker from the medical community. And so we have a doctor who comes to speak, and then we add something for everybody. So we might have a Diabetes 101 segment, something very basic, or bring in somebody who is a diabetes product or service to talk about a new innovation. And we work with Marion Polk Food Share, so we have produce people can bring home
I'm
with
sure
them.
that it's probably the whole eating issue is probably overwhelming because
It
that's
is.
one thing that people don't like to change. And if you're in a family, they don't want to change, or maybe they've never had to experience that. So you're fighting against the tide of the society all the
Yeah.
time.
And
Yeah.
there's, oh, I'm sorry.
No, I was just thinking, when people come to us, when they normally engage in Western healthcare, they're diagnosed and then they're told what to do. The difference in what we do is they come to us and we say, what is it that you want to achieve? And by and large, they say, I want to live longer, I don't want my feet to hurt, I want things that are really simple. And that's what we deliver. And so I think it really just boils down to making it practical. And you really can't do that easily unless you've lived it every single day, and that's what Sandra and Al have done for the past 50 years. And so they're just jewels in the local community. And my job is just really to kind of sit behind the scenes and make sure all the bricks of the organization line up so we can just build this really solid foundation to keep helping as many people as possible.
That's so wonderful. And it sounds like that when they get involved with DSS, they're with people who understand.
Yeah.
And
Absolutely.
it is hard for some of us to understand. You've educated me a tremendous amount today.
Wonderful.
I want to hear one more time. Maybe tell me again your phone number and your website address and how they can get in touch with you.
Okay, our phone number is 503-585-1335.
Okay.
And they'll get a real person. That will be me, probably.
Real person. Wow, okay.
But if it goes in a recording, I try to call back soon.
Very well.
And our main website is www.sugarsmart.org. We have 2 health fairs coming up. We have a health fair website that is sugarsmart.info. And our sugarsmart.tv is the one with the videos.
See all the great videos. That's wonderful. Well, we'll look forward to hearing more about what you're doing at DSS. It'll be very exciting. We'll look forward to meeting Cozy the Chihuahua soon, hopefully. But maybe if they go to a meeting, will they get to see Cozy possibly?
Oh, that's not a good
even,
idea. No,
not even a good idea. Not even a good idea.
It's extremely territorial.
Very well. Well, that's wonderful. So thank you so much,
you.
Nathaniel and Sandra, for joining me
Thank
today.
you.
And thanks for joining us on our program. We will be bringing you more about Diabetes Support Services, way to learn about your diabetes. We're going to hear from a professional trainer who's had diabetes her whole life and how she's learned to manage that, and also exercise for folks that are challenged with diabetes. So follow us on CCTV, and we'll see you soon.